important that boards demonstrate leadership in times of change because we know from decades of research with change management experts that you really need the leaders of the organization to be the ones who are setting the tone from the top. And of course, in healthcare, the leadership includes the board along with the administration and clinician leaders. One of the things that's important for leaders to do at this time is to make sure that they're being honest about what kinds of challenges they're really facing, and then to be able to create a vision for the future that everybody understands and can agree on. One of the other reasons that it is important for boards to provide leadership in times of change is that when there are massive changes required, the board and other leaders need to raise the bar and make sure that everybody understands that this is a new world and we need to be doing things differently. And it is up to the board and the other leaders to really provide that kind of emphasis. There are 4 major governance practices that boards need to adopt to provide leadership in times of change. The first one is to intensify education. In other words, make sure that they are involved in initial orientation programs that help them understand the healthcare environment and their own organization and the market that they're operating in. And then secondarily, to make sure that they have an ongoing understanding of the external environment in which we're operating right now. And I think there's a third component right now, which is that more often than not, hospital board members are used to looking at inpatient acute care issues and maybe have been involved in strategic planning for that kind of purpose. But now we're trying to create entire care systems across the continuum of care. And I think that there's another educational layer that needs to be added on, which is to make sure that board members understand what is the full continuum of care. What does that mean they are now responsible for overseeing? And how is it that they then need to educate themselves further based on that need? The second key governance practice is to clarify roles. And I mean that on multiple levels as well. One level is that board members, I think, need to spend some time when they first come on the board understanding in the healthcare environment, what's the right role of a board member versus management. For instance, in smaller, not-for-profit organizations, the role of a board member may be different than it is in a large, complex healthcare organization that has very skilled executives. So they need to understand what then is the role of a board member in that environment. Then they also need to understand and talk together with management about what role are they going to play in helping to do strategic planning, to address the needed change or to even articulate the needed change. Because I'm finding that there are differences of opinion and philosophy about how engaged or involved board members ought to be at various stages of a strategic planning process. So that leads into the third governance practice, which is helping to clarify the vision and agree on the vision. Hopefully, if the board members have been sufficiently educated about their own organization and the market and the external trends, then they're going to be able to participate together with management in determining what vision can they all sign up for. Because unless you have a clear, articulated, common vision of the change you're trying to create, it's very difficult to actually accomplish that change. Then the fourth key governance practice is to hold everyone accountable. And I do mean everyone. For instance, it is important to make sure that once a vision has been created and a strategic plan with goals has been created, that the board provides leadership by monitoring management's progress vis-a-vis those goals and towards the vision. But the board has to hold itself accountable too in a variety of ways. One way is it needs to revisit its own board meeting agendas and materials to make sure that they're making time for strategic conversations and that they're actually making time for the processes and the discussions around, well, what do we do if a certain part of our vision hasn't been accomplished? And so I think that it's important that the board spend time assessing its own performance as well as holding management accountable.